Good morning to you. Thanks so much for joining us. Welcome, whether you're joining us on TV or online. I'm Farah Nasser, and we are waiting for the Prime Minister's daily address to begin. He's expected to speak any moment now outside of Rideau Cottage. That is ahead of today's weekly in-person meeting off the House of Commons, which happens every Wednesday now. And while we wait, we want to give you a baseline, as we usually do, with where the numbers stand here in Canada. Let's take a look. 71,000 Canadians have now tested positive for COVID-19. Almost half of those cases are considered recovered. That's the good news. There are, though, more than 32,000 active cases, and more than 500 of those patients are in hospital right now in serious or in critical condition. We can also tell you now that more than 5,100 Canadians have died because of complications from the virus. The number of new COVID-19 cases in Canada continues to drop or remain at zero in all provinces except one. British Columbia is reporting 7 new cases. That's the lowest number of new cases that they've had there in weeks. There are 45 new cases in Alberta and 329 in Ontario. That's 30 fewer compared to last Tuesday. Quebec, though, reporting 756 new cases, 8 more than in the previous days. Our global news team is standing by to bring you the very latest on the spread of COVID-19 here in Canada. We're going to talk about the tale of 2 reopenings. We'll hear more about British Columbia's plan and Ontario's plan. We also have Michael Couture, but here is the Prime Minister now.
Bonjour tout le monde. Hello, everyone. Today, I want to start by highlighting some good news. Last night, Health Canada announced that it has authorized the first serological test for COVID-19 antibodies. This is a critical step for the work of the COVID-19 Immunity Task Force, which now has a safe and approved test that can detect antibodies specific to COVID-19 in an individual's blood. These tests will help us better understand immunity against the virus and how it spreads, so we can keep Canadians safe and healthy.
Yesterday, Health Canada announced that it authorized a first serology test for antibodies to COVID-19. This is crucial progress for the task force on COVID-19 immunity, which now has a safe and approved test that will make it possible to detect antibodies to COVID-19 in people. This is an important stage in gaining a better understanding of immunity against the virus and how the virus propagates. It will help us protect Canadians.
I now want to turn to what we're doing to help employers keep their employees. Over the past few weeks, our government has unveiled a number of measures to help businesses stay afloat during the crisis. We want to make sure that as many Canadians as possible can keep getting their paycheck now and have a job to come back to once the pandemic is behind us. Because that day will come, and when it does, Canada needs to be ready. Our government has been laying the groundwork for our economic recovery, and we know that key to our collective success is maintaining the connection between employer and employee. So, to help businesses of all sizes keep people on the payroll, we launched the Canada Emergency Wage Subsidy. We also introduced the Canada Emergency Business Account to support those struggling with cash flow. These measures are making a real difference in people's lives. So far, more than 500,000 small businesses have received a loan through the CEBA, and over 120,000 employers have been approved to receive the Canada Emergency Wage Subsidy for almost 2 million workers. We also announced more targeted support for regional businesses, including those operating in the tourism sector and seasonal industries. We created a nearly $1 billion regional relief and recovery fund to ensure that they're also getting the support they need during this time. The funding will flow through the 6 regional development agencies, with a portion dedicated to the Community Futures Network to assist businesses in rural and remote regions. Today, we're releasing more details on how that money will be split between the Atlantic Canada Opportunities Agency, Canada Economic Development for Quebec regions, FedDev Ontario, FedNor, Western Economic Diversification Canada, and CanNor. And here's the bottom line. These organizations understand the economic realities and specific challenges facing both your region and your business. They can help you with your most pressing needs, whether it's covering costs or keeping your employees. So if you're struggling but did not qualify for other programs like the wage subsidy or the emergency business account, give them a call. They're there for you. Il y a quelques semaines, on a créé le fonds.
Several weeks ago, we created the Regional Help Assistance and Relief Fund, which has almost $1 billion in its budget to help small businesses in rural areas or in tourism or seasonal industries. These funds will be dispersed through the 6 regional development agencies. Part of the funding will also be earmarked for community futures development to support businesses in rural and remote areas. Today, we'll be providing more detail on how this funding will be divided among the regions. Regardless of whether it's a FedDev or Community Futures Network, these organizations understand economic challenges on the ground in your regions and for your business. They can help you meet your most urgent needs, be it liquidity or problems keeping your employees. So call them, they are there for you.
From the outset, our government has been focused on getting people the help they need as quickly as possible. We announced support not just for businesses and their employees, but for different groups of people who've been hit especially hard by the pandemic. A few weeks ago, we launched the Canada Emergency Student Benefit as part of our $9 billion plan to help young people get through the next few months. And today, I can confirm that students and recent graduates will be able to apply for this benefit starting Friday. To prepare for that, if you haven't already signed up for the My Account on the CRA website, it's worth doing this now to make the next steps go even quicker. J'ai aussi des nouvelles pour les étudiants et les nouveaux diplômés ce matin.
I have news for students and new graduates. As of Friday, you will be able to apply for the Canadian Emergency Student Benefit. The new benefit is part of our $9 billion assistance plan to help you through the pandemic. Because of COVID-19, there are fewer jobs for students this summer, and you need to work over the next few months to help to contribute to your tuition and your expenses over next year. The Canadian Emergency Benefit for Students will be there for you. You can apply as of Friday. In the meantime, however, do go to the CRA website and sign up for My Account. That will speed things up for you. This morning, I'd like to conclude by reminding everyone that they should follow recommendations by public health experts. We're talking a lot about gradually reopening the economy. We are all very keen to move on, but we have to remain careful. Stay home as much as you can, and do maintain physical distancing when you go out. Thank you, Prime Minister. We'll move to questions on the telephone. First question. Michel Lamarche, TVA. Mr. Trudeau, you were talking about reopening the economy. It is starting. Now, with regard to the wearing of non-medical masks, are you ready to issue directives to Canada as a whole, the directive that people should wear masks when leaving home? We are seeing different regions facing different circumstances. In PEI, things are very different from what they are in Ontario, for example. So we need to allow local and provincial authorities to establish the principles and guidelines that are best suited to their own circumstances. But as we know, the best ways of protecting oneself are staying home as much as possible, and if we must go out, stay at least 2 meters away from anyone else. According to the experts, a mask can help, but does not replace social distancing. Michel, supplementary? Thank you. Last week at Trenton, you were wearing a mask, even though you could maintain distancing. Why did you do that? And regarding the border, why are the Americans resisting extension of the border closure? At Trenton, it was at the armed forces' request that everyone wore a mask, so we all did. As for the U.S., we're having extremely constructive discussions. These are continuing. Discussions with the U.S. administration, that is. And so far, the partnership has been fantastic, and I see no reason why it shouldn't continue being so.
Highlight that since the very beginning of this pandemic, the communications and the collaboration with our American partners has been exceptional. Conversations are ongoing all the time on a range of measures, including border measures. And I can tell you that up until now, the collaboration has been exceptional, and I see no reason for that to change.
Merci. Opérateur, prochaine question.
Next question, please.
Next question, David Lundgren, Reuters. Line open.
Good morning, Prime Minister. On the border, we understand that the two sides are going to agree to keep the restrictions in place until June 21st. But what happens in future if you decide the border should be shut and the Americans decide it should be open? Will you go ahead and keep it shut even though your biggest trading partner is urging you to open up?
Right now, we're making decisions for right now. Obviously, there are reflections on what next steps could be and might be in different situations and different progressions of COVID-19. But every step of the way in this unprecedented situation, we're reacting to and responding to the realities we see now, and that's where we will stay focused. We're focused on keeping Canadians safe every step of the way, and we'll take the necessary decisions at every different step.
As a follow-up?
Secondly, Norway's sovereign fund, which is the largest of its kind in the world, is blacklisting 4 Canadian oil sands firms. What's your reaction to this? And doesn't this suggest that the major oil sands producers have a lot more work to do for you to consider that they're aligning with federal climate goals?
We've seen investors around the world looking at the risks associated with climate change as an integral part of investment decisions they make. That is why it is so important for Canada to continue to move forward on fighting climate change and reduce our emissions in all sectors. And I can highlight that many companies in the energy sector have understood that the investment climate is shifting and there is a need for clear leadership and clear targets to reach on fighting climate change to draw on global capital.
Thank you. Operator, next question.
Thank you. Merci. Next question, Ryan Timilty, National Post. Line open.
Yeah, good morning, Prime Minister. Yesterday, the Toronto Transit Commission came out and painted sort of a really dire financial picture for the next couple of months, and it's dealing with the same sort of, other transit agencies across the country are dealing with the same sort of financial picture. I'm wondering if you think the federal government will have a role in helping to deal with that, especially if it could mean big service cuts or potentially these transit systems not operating.
I think we recognize we're in a very, very difficult situation right now where we have asked Canadians to cease a massive part of the economic activity that keeps this country going. We've done this for the very important and clear reason of protecting Canadians' lives, because we know that protecting the health and safety of Canadians is necessary for us to move forward with a strong country economically or otherwise. That's why the decisions we've taken to keep Canadians safe need to come first. At the same time, we are looking at careful reopenings in gradual ways in different parts of the country, and the federal government will be there to support the provinces and other organizations and industries as we look to doing it the right way in a way that keeps Canadians safe. There are going to be a lot of very important and difficult decisions and delicate balances to strike over the coming weeks and months, and we will continue to be there to work with all partners to make sure that Canada is getting it right for Canadians.
As a follow-up, Ryan?
Yeah, I'm sorry, sir, but on transit systems specifically, like the Toronto Transit Commission, like OC Transpo, that are struggling with their revenues, do you think the federal government will play a role, or do you think that's a provincial responsibility?
Well, as we know, operation of transit systems is a provincial and municipal responsibility. As a federal government, however, we have made significant investments in upgrading and strengthening transit systems across the country, because we know it's such a key part of both prosperity and moving forward in ways that make life affordable and fighting climate change at the same time for Canadians. So we will be there to listen to concerns that Canadians are expressing and that different orders of governments are expressing on making sure that our reopening is successful. We know that public transit and getting people to work is going to be an important part of our economy moving forward, but we also know that the challenges posed by social distancing and much greater working from home has come and affected our transit system significantly. So we're going to have to adjust, and the federal government will be there to work with the provinces, including supporting them in their areas of jurisdiction in many cases. Nous savons que le transport collectif est important.
We know that public transit is important to the economy, will be important as the economy starts up again, but there are social distancing challenges on public transit, and a lot of people are working from home. Therefore, our public transit systems have seen their revenues fall. We will be there to support provinces and municipalities if need be, but we recognize that public transit systems are operated by provinces and municipalities, not by the federal government. But, as I said, we will be there to help, because we need Canada to reopen with success, in safety, but, of course, gradually. Last telephone question, please.
Question, Lina Dib, La Presse Canadienne. À vous.
Lina Dib, Canadian Press. Thank you, Mr. Trudeau. I'd like to get back to long-term care facilities. You said you want to help, but you don't want to encroach on provincial areas of jurisdiction. So are you just talking about transfer payments or some other kind of intervention? There are conversations to be had among the provinces, among different levels of government, and with Canadians to see why our seniors are in this situation and how we can prevent this from happening again. The federal government will be there to help. Sending in the armed forces to help in long-term care homes was a federal commitment, but it was done respectfully and in cooperation with the provinces. We will continue working with the provinces in a spirit of positive cooperation to make sure we do the right thing for Canadians. Supplementary, Lina? But I'm sure the Army won't be there long term. So when it comes to sustainable solutions for these long-term care homes, what are you thinking of as solutions if it's not sending more money? Given that the problem is now so apparent, why would the federal government not also focus on it?
Lina, qu'on est dans une situation extrême.
Lina, I think we all recognize that it is urgent that things be done now to help out in long-term care homes. That is what we're doing. That is what we're focusing on. But in the months and years to come, of course, we will have to focus on how our seniors are being cared for across the country and improve the systems that support them. The federal government will have a role to play in that, but it will be done in cooperation with the provinces and with respect for them.
Officer yesterday said Americans pose a risk to us. So I wanted to know, when was the last time you talked to President Trump about the border, and what pressure is the U.S. putting on Canada to reopen?
I think every country recognizes that as we control our domestic situation, we are vulnerable to international travelers. Different countries are facing different challenges, and as we manage the spread of COVID-19, we will want to make sure that we're not becoming vulnerable from travelers arriving elsewhere. That's why we made strong moves to close our borders, including to American travelers at this time. As we move forward, we will continue to work with the administration, and I can highlight that the work with the American administration continues to be constructive and positive. I have spoken with President Trump a number of times over the past weeks, and our conversations have always been very positive. Je pense que nous reconnaissons tous que en même temps qu'on protège.
We all recognize that while we can protect Canadians inside the country with measures to contain the spread of COVID-19, we remain vulnerable to cases that could come from outside our borders. That is why we are stringently limiting international travel, including people coming in from the U.S. We will continue our extremely positive cooperation with the U.S. administration. I've spoken with President Trump a number of times in recent weeks, and those have been positive conversations.
2 months since you've started giving these updates. I know Canadians appreciate that. But for obvious reasons, we don't have a budget right now. The PBO says the deficit could reach $1 trillion by the end of the year. How much longer will Canadians have to wait to get a financial picture here of how much all of this is costing us?
I think Canadians rightly expect us to be focused on the immediate and getting things settled so that Canadians can actually feel safe and look at careful reopening. But at the same time, we have been transparent every step of the way about the investments we're making, and we will have, of course, we will continue to share with Canadians our outlook for the future. We recognize, however, that the situation is changing incredibly rapidly, and a budget is usually something that projects what's going to happen in the Canadian economy for the next 12 months. And right now we're having a lot of difficulty establishing with any certainty what's going to happen in the next 12 weeks. We will continue working on this. We will continue to be open and transparent with Canadians as much as possible, but we will stay focused on helping people in the immediate as we move towards a better future. Nous savons qu'on est dans une situation sans précédent.
We know that this is an unprecedented situation where things are changing extremely quickly. A budget and an economic statement generally make projections for the next 12 months or so. Right now, we're having a huge challenge just foreseeing what's going to happen in the coming 12 weeks. We will continue to be open and transparent with Canadians. We'll talk about our projections for the coming months, but at the same time, we will keep focusing on what we need to do right now to make sure that the future is as rosy as it can possibly be.
Just to come back to Molly's issue about the border, federal agencies have to plan to maintain the current U.S.-Canada border agencies. Municipalities on the border have to make some plans about this. Can you sort of give them some assurance today that the U.S.-Canada border restrictions will stay where they are until the end of June?
We are a good week away from the expiry of the current phase of our border restrictions with the United States. Conversations are ongoing, are constructive or productive. I won't make any announcements today, but I can say that things are going well, and we're confident about being able to continue to keep Canadians safe.
And to come back again on Molly's question about fiscal updates and budgets, when we went through this, the crisis in 08-09, we had multiple fiscal updates. We've had lots of years where we've had multiple budgets because of elections or whatever, and it's really hard to understand why you couldn't have a budget now and update that budget in 3 months or even a month if you needed to. Why not a budget, or at the very least a fiscal update with the promise to update it in a couple of months?
Again, we have been focused very much on responding to this unprecedented situation by getting money into the pockets of Canadians, of workers, of families who need it right across the country. Unlike previous recessions or economic downturns, this is a situation that has no antecedents. It is a completely outside important health issue that has caused us to choose to cease a massive amount of economic activity in this country to keep Canadians safe. We continue to work every day on supporting Canadians. We continue to be absolutely transparent about the measures we're putting forward for Canadians, and we will continue to look for ways to keep people apprised on what we expect for the coming months. But as we say, things are changing extremely quickly, and we want to make sure we're putting our efforts where they are most useful, which is both sharing with Canadians everything we're doing as we're doing it, and staying focused on what we need to do right now.
Good morning, Prime Minister. Tonda McCharles, Toronto Star. This week, medical research institutes across the country will begin to lay off 10,000 to 15,000 people who work on health research because they can't get the support of the federal government. They don't qualify for your wage subsidy program. And that's going to have a cascade effect even on the COVID research that's happening because these research institutes provide the infrastructure that supports that. So can you explain to me why it's not a priority to keep those critical employees tethered to their employer?
On the contrary, Tonda, we have made significant investments in the hundreds of millions of dollars into science and research across Canada. We know that this is a crisis that is science-based. It's caused by a medical challenge of COVID-19, and we need to use science to get ourselves through this. That is why our investments in science, our investments in supporting graduate students, our investments in supporting research institutes have been significant and will continue. So I will follow up and look into this issue you're bringing up, but our focus is on making sure that scientists get the support they need right across the country, and we will continue to do that.
Thank you.
Hi, Prime Minister. Tom Perry with CBC. Ontario says it's going to wrap up testing at long-term care facilities in the next couple of days. Quebec is nowhere near that. You're a Quebecer, you're a Quebec MP. Can I ask you, why do you think the province is having such a hard time with this? And is there anything more you can do to help?
The responsibility of the federal government is to support the provinces in delivering their plans for things like testing, for things like PPE, their plans for reopening. We are there to work with the provinces to ensure they have the equipment and the capabilities they need, whether it's been procuring swabs for testing kits around the country, whether it's moving forward on domestic production of the reagent necessary for producing results from those tests. The federal government has been extremely active, and we will continue to be there to respond to the provinces and their plans and their needs for more testing. It's something that we know is an essential part of how we move forward on a careful reopening. Le rôle du gouvernement fédéral, c'est d'être là pour appuyer les provinces.
The federal government's role is to be there to support provinces in their planning, be it to provide and obtain personal protection equipment, testing kits, reagents needed to analyze the samples. The federal government has done everything it can to support the provinces, but testing strategies are approved by the provinces. The federal government will support them, as we do now.
Steve Chase, Globe and Mail. Mr. Prime Minister, your ambassador to China, Dominic Barton, told a group of Canadians last week that China, because of its conduct, is alienating foreign countries and injuring its goodwill abroad. As Mr. Barton put it in foreign policy jargon, China is accumulating negative soft power around the world. That is, it's undermining its international influence and the ability to persuade other countries to see things Beijing's way. Now, you hired Mr. Barton because of his expertise in China. So the question for you is, do you agree with his assessment?
I think it's clear that there are many questions for countries around the origins and behavior in early days on the COVID-19 situation, particularly questions for China that we've called on to need to be asked in the coming months so we can get answers. At the same time, we're seeing a global pandemic that requires a global coordinated response, and how countries are behaving now towards each other, supporting each other, moving forward in a difficult time is being noticed by everyone. And I think it's totally normal that we be asking questions about how different countries are behaving, including China. Okay. depuis les débuts, nous savons qu'on va avoir des questions difficiles pour
Ever since the beginning of this crisis, we've known that there will be questions on the origin of the pandemic and on how it became a global issue. But we know that a pandemic requires a global response, so countries have to work together to get through the crisis. And countries that don't behave as they should will certainly find themselves having to answer questions, and that's quite natural.
Louis Blouin de Canada. You were very cautious with China for the last few weeks every time we deal with China, especially with the idea which has been put forward by Australia regarding an inquiry. Are you fearing some impact on the medical cooperation? My responsibility at any time is to guarantee well-being and safety to Canadian citizens. So we should work with all countries throughout the world for the purpose of getting the necessary equipment and means to manage through the crisis. So, of course, questions will have to be answered on the manner in which everybody has behaved, including China, in the future. But at each step, I have to do all that I can for the purpose of protecting Canadians through the crisis, and this is what I'm going to do.
First and foremost, as Prime Minister, is to look out for Canadians, to make sure we're keeping Canadians safe and healthy and whole as much as possible in good times and in times of crisis. That's why, even though, of course, we will have very strong questions to ask of many different countries through how this pandemic began and propagated around the world, my focus needs to be on ensuring that we're getting the support necessary for Canadians every step of the way, in terms of PPE, in terms of testing capacities, in terms of partnerships towards getting treatments and vaccines for this. My focus needs to be on keeping Canadians safe, and that's where it will stay.
Merci beaucoup. C'est ce qui m'a fait la conférence de presse d'aujourd'hui.
Merci tout le monde.
This ends the press conference. Thank you.
That's Prime Minister Justin Trudeau. He is going to be heading to the House of Commons later on today for an in-person sitting there. And he spoke about the Regional Relief Fund, details on that today. But let's start with Michael Couture. Mike, let's start with the border, because that's where a lot of the questions came from. That's where a lot of people's minds are. When will the Prime Minister reopen the border? And he has to choose his words very carefully, as every world leader does, when addressing the United States and the government there in the United States. We didn't get a date, but what did you notice about the Prime Minister in terms of how his messaging and tone has shifted on this in the past week?
Well, he continues to say, look, we will have to make this decision in concert with the U.S. and that they continue to have good relations with the U.S. He also mentioned that it's not just about Canadians, but making sure we protect ourselves against travelers who could bring the virus into Canada. He also kind of, when our own David Akin asked again, it was multiple times that he was asked this, he kind of put his foot down and said, look, I'm not making an announcement today. We still have a week to go. We're going to continue discussing it with the U.S. But I think the Prime Minister is well aware of the pressure that could be coming from President Donald Trump, because, as we've said many a time, he wants to reopen his economy, and part of that may include Canada. But what the Prime Minister will have to do next time he talks to Trump, or next time Chrystia Freeland talks to her counterparts across the border, that's the Deputy Prime Minister, is she'll have to say, look, the goods can still flow over, you'll still have the economic benefits, we just basically don't want your people, if that's okay. And so that is the tightrope that they have to walk, in that fine line. But the Prime Minister trying to reassure everybody that the decision to do it would be about trying to protect Canadians. And he did allude to it yesterday as well, in terms of if any kind of traveler coming into Canada would want to come into Canada, that they would have to have some sort of a 14-day quarantine period. And that might be just enough to dissuade people. But the flow of goods and services services continues. Those essential goods and services that go across our border with our largest trading partner continue to go. So I think the Prime Minister is looking at this and saying, we'll make a decision when we have to, and the talks are ongoing, but at the same time, there is that sort of difficult and delicate dance he has to perform.
Clearly, and we know that the premiers of both British Columbia and Ontario do not want to see that border open anytime soon.
Exactly.
The other question is about tourism, because we do get a lot of tourism numbers, especially in the summer, from the United States. And we do have this nearly $1 billion plan to help small businesses. Will that help the tourism sector?
Well, he made reference to the tourism sector when he was talking about that money and how it will be rolled out. One of the things that might happen is when you consider that it flows to all of these different regional diversification agencies, is whether or not they will start to look at, let's say, for instance, we keep on that example of not allowing tourists into Canada. If, for instance, provincial borders are maybe a little more relaxed or opened up, and then Canada sort of looks inward and says, maybe this is a good time to focus our energy on promoting Canada to the rest of Canadians. And hey, look, you can travel within Canada if you're a Canadian and start visiting different places. That is a possibility. The other consideration with this money would be that they would say any of these tourism industries that ramp up in the summer. I mean, one example here in Ottawa, the bus tours, frankly, any city that has a bus tour, they may be hurting, and that's maybe where this money goes to help those types of companies. But if there is a relaxing, if there is the possibility that some of these industries can restart again, there may be a mind to going at this, looking at it, well, maybe we should promote Canada to Canadians as a place that you can travel. If the restrictions are relaxed enough that the government can say to Canadians, travel within your own borders, discover your own country rather than trying to go abroad, and do that this summer, towards the end of the summer. If those restrictions are relaxed, that might be a possibility. But we are already seeing, by the way, that $962 million, we're already seeing a breakdown. There have been press releases while the Prime Minister was speaking. So I'm just going to give a quick breakdown for people who are watching across the country. So ACOA, which is the Atlantic Canada Opportunities Agency, they're getting $110 million, which will flow to the businesses on the ground there. The Canadian Economic Development for Quebec region, so that's specific to Quebec, it's getting $211 million. I haven't seen any news releases yet for any of the regional agencies that deal with Ontario, but you can expect those to roll out. And in just about 20 minutes or so, Melanie Joly, who's the Minister of Economic Development and who manages those 6 agencies, will surely be talking about how that money will be flowing out. And it looks like the Prime Minister has decided those details will go to the ministers at that meeting so he doesn't sort of scoop his own ministers.
Right. Speaking of money and numbers, $1 trillion. That is a number that's really hard to get your head around. The parliamentary budget officer told the Finance Committee yesterday it's possible that's where our federal debt could be this fiscal year. Tell us more.
Yeah, and Farah, I just have to correct you when you do it. I think you have to do the Dr. Evil pinky to your mouth. $1 trillion. I'm kidding. Let's have a little fun with this one, can't we? Since it's not our money, right? I'm kidding. Of course it's our money. It's Canadians' money. So it's $1 trillion. He was asked at the Finance Committee yesterday, Yves Giroux was the parliamentary budget officer, by the Conservatives, asking whether or not it was possible that the federal debt for this fiscal year could top $1 trillion. Keep in mind, just a few weeks ago, the PBO had estimated that the federal debt for this fiscal year could be $252 billion when you add up all of the economic measures that this government has already announced. So in response to that pointed question, I'll read for you the transcript. Is it possible? Yes. Realistic? Yes. Certainly not unthinkable. So also, the PBO noted on Tuesday, when he was being asked about these very questions, that when he provided that $252 billion number, he was being optimistic about it. Now, the Prime Minister was asked today about some sort of a fiscal update, a budget. Our own David Akin had said, look, in past crisis in past economic downturns and recessions. We've had multiple updates. And the Prime Minister was clear. Look, we are looking right now at the health of Canadians, both financially and physically. So they want to make sure that Canadians can pay the bills, pay their rent right now. And they will sort of look at where how to pay for all this later. Not music to the ears of conservatives, that's for sure, or people who are conservative-minded, and Canadians who worry about this type of thing, obviously. My inbox has been full of people who have noted that it is important to them. And so when he continues to be pressed on it, the Prime Minister focuses on that, saying, look, this is really about the response now. And the reason he compares it to other recessions, and he says it's not a comparison. In other recessions, we kind of knew what the end would look like. This one, we have no idea. And I've spoken to officials at Finance Canada, and they have said to me, look, we would like to provide a picture, but consider this. We could give you a snapshot today, and it may not be worth the paper it's written on in a week. And for that reason, we are waiting until we have a better idea of where we are going with this crisis and where this virus is going. I mean, Farah, just think about it this way for a moment. You have provinces that are already thinking about reopening, and then Quebec is talking about delaying that reopening. So a reopening of the economy would obviously spur a bit more economic development, would put money into different government coffers. But if governments are even sort of tiptoeing back and forth and sort of hemming and hawing about whether or not they can do it week to week. Think about what the federal government is looking at this and how they're looking at this. They can't make a projection based on whether or not a province is going week to reopen. So that, I think, is why there's a difficulty. When you speak to the people in the finance department, they're just looking at this and saying, we're waiting for some sort of consistency in the economy and in society, frankly, and then we can provide a better picture of it.
Everybody wants a plan, but this is, I know we keep saying this, unprecedented. This is fluid in every single sector. So, Mike, I'm going to let you get to work, because I know you want to find out where else that almost $1 billion is going, and we'll come back to you in a bit. But let's zero in on Travis Stanrad. Travis, one of the things the Prime Minister ended with was, support for PPEs. He talked about that. And we have been bringing this up for 8 weeks to the government in terms of the PPE shortage for frontline workers. We have had long-term care workers who have died in this country. We now have our first registered nurse who has died from COVID-19. What do we know about this nurse?
So Brian Beattie worked at Kensington Village in London, Ontario. That's a long-term care home where there has been an outbreak. We know that 8 staff have tested positive. 5 residents have died at that facility. And Brian Beattie was a registered nurse, the first in the country to pass away from this. And as you said, Farah, Ontario has, along with all the other provinces, but Ontario particularly has struggled with long-term care homes, with PPE issues. This province had to call in the military to help deal with 5 of the hardest hit long-term care homes. And an announcement today that the government is now moving to take over, or they could take over, some long-term care homes. It's a move that British Columbia has already enacted, but the government has been pressed as to why they aren't moving in and taking over some of these long-term care homes. We don't have a lot of details as to whether or not this was a community spread, or whether or not Mr. Beattie contracted COVID-19 from his work at the facility, at this long-term care home. But the president of the Ontario Nurses Association put out a statement today, as did the home, talking about the fact that he was someone that viewed the residents, viewed his other colleagues as family, that he really wanted to come into work and help these folks in their time of need, and that he didn't think twice about it. And that just shows the dedication that some of these frontline workers have. And I'll also point out that it is Nursing Week right now. So, the Nurses Association says how ironic that we are mourning the death of the first registered nurse in Ontario while having to fight still for personal protection equipment. The Premier, Doug Ford, here in Ontario, was asked about PPE specifically yesterday, because the legislature did sit yesterday, and he said, listen, every long-term home, every frontline worker that wants personal protection equipment should be able to get it. All they need to do is put up their hand. They need to call my office if they can't get it for some reason. But we know from the frontline workers that is still not happening. PPE is still a major issue, Farah.
Yeah, it's not. If only if it was that easy, just putting up your hand and getting the personal protective devices. Again, we brought this up first, I remember, on March 16th, and we're now 8 weeks later, and still it's an issue, these PPE. And frontline workers, we know, are more likely to get COVID than people in the general public. So because they are so close to it. Let's shift our focus now on Ontario's reopening plans. I know the Premier there hinted that we might get an announcement even about school next week.
Yeah, so, Mike was talking a little bit about how this is a little bit of a delicate dance, and we have certainly been seeing that here in Ontario. They're kind of looking at the Goldilocks approach. They don't want to go too slowly because they have, obviously, the fiscal concerns that every other province has, but they also don't want to go too quickly because they have said that, they are concerned, as is everyone else, about a second wave and what opening up could look like if it happens too quickly and there are too many events outside and too many people going to businesses, etc. We found out yesterday that on Thursday, the Premier is going to make an announcement on what stage one of this three-phased approach is going to look like to reopen Ontario. There are some businesses, just a few businesses, that are able to open fully right now. Garden centers, hardware centers, among others. But we could see on Thursday a target date to opening more like restaurants and bars and things like that. But again, the Premier very cautious when he's saying that they are going to be easing restrictions, that this target date is going to be advised by the Chief Medical Officer of Health, and the fact that they're seeing case numbers come down. Now, the trend has been fairly good here in Ontario over the past couple of days. We are seeing overall a downward trend, but they are cautiously optimistic that they can open things up. But they don't want to put too many specifics, too many hard details and dates on things, so that they may have to roll things back if the situation changes, which we know it can in a pretty quickly in an instant, Farah.
You're right. Let's talk about something that's really a symbol of summer that's now closed in Toronto. That is Canada's largest fair, the Canadian National Exhibition. It has been officially canceled. I know my kids were really disappointed at this news because it's really a symbol, as I mentioned, of summer. Why is it being canceled now? Why aren't they waiting, Travis?
Well, they are, again, I talked about that second wave, and there are big concerns about large gatherings. The CNE is kind of the event in Toronto, in Ontario, that marks the end of summer, and millions of people go into the gates at Exhibition Place there and go to the CNE grounds. It is much like the Calgary Stampede, which has been canceled already, the PNE out in British Columbia. But this is only the second time since the Second World War that the event has been canceled. So the president of the CNE Association said yesterday that they have to do this out of an abundance of caution, that these are unprecedented times and they have to take these precautions. We know that the summer is going to look very different here in Ontario. The big Pride Parade, that has already been canceled. They're looking at virtual ways to celebrate Pride Month. We know that the Caribbean Carnival, which is another huge event, brings in a lot of money to the Ontario economy. That has been canceled as well. And we're looking at the Toronto International Film Festival, obviously a huge event for Toronto. They are looking at different ways as to how they can do that, because that again happens in September. So the summer looking very different right now. And the Premier says even once we get through some of these stages, large events, sports gatherings, etc., may not be able to happen as planned. We might be seeing Leafs games, baseball games, Jays games happen without a crowd, Farah, which would be unprecedented again.
Yeah, it is. It's a different world we live in. Travis, thank you. Let's go to Richard Zussman. He is in British Columbia. You heard Travis talk about the PNE also being canceled. But Richard, the province is reporting the lowest number of new COVID-19 cases in weeks. Tell us the latest coming out of Victoria.
Yeah, yesterday, just 7 new cases of test positive COVID-19 here in British Columbia, Farah. That is the lowest number we have seen since March. And it's part of a trend line that we've seen here in British Columbia over the last few weeks. And that's why this province is moving towards reopening on May 19th. So there are a number of steps involved with the gradual reopening of BC's economy, but it does focus on a number of sectors in the economy. British Columbia also didn't close as many things as other jurisdictions like Ontario and Quebec, but restaurants will be able to start operating, it looks, as soon as next week. The plans for each individual restaurant will have to be approved by medical health officers, and there also will need to be a posting at every restaurant or online describing to the public how they are going to maintain physical distancing guidelines and ensure that both patrons and staff are safe from the spread of COVID-19. We're also expecting later this week some more details on the reopening of schools. Some vulnerable kids and kids of essential workers are in schools now, but this is going to be a larger reopening targeted for the beginning of June. It will be optional for parents here in British Columbia, but will very much be part of the plan of reopening. The one thing the province, though, does not want to see reopened are those borders. Farah, I know you were talking to Mike about that earlier. A lot of questions to the Prime Minister today. Premier John Horgan here in British Columbia has been adamant that the border should not open, and they should not open anytime soon. The Premier does not want to see the hard work of British Columbians thrown to the wayside if it means visitors are pouring across the border from Washington State and other places in the United States into British Columbia. So that is the message from the Premier, who keeps speaking to the Prime Minister and Deputy Prime Minister Chrystia Freeland about BC, saying we do not want these borders reopened anytime soon.
Same with Premier, as you mentioned, Premier Doug Ford saying the same thing. Let's talk about the cruise ship industry. It's obviously very big for British Columbia's economy. What's the chance of cruise ships returning for the summer?
Very, very little chance. And Dr. Bonnie Henry, the Chief Medical Health Officer here in BC, was asked about that yesterday. And again, the message is we do not want this industry here now. There will be formally no cruises until July 1st, but the hope from the BC government is that is extended. And I think the sense is they do not want to see the cruise industry at all in British Columbia this summer. There are just far too many risks associated with cruise ships at this point for the spread of COVID-19. A number of cruise ships, hundreds, come through both Victoria and Vancouver. It is part of the lifeblood of the tourism economy and is leading to a pretty significant blow to the local economy in terms of tourism dollars. But the provincial health officials say it's just not worth the risk to allow cruise ships back and operating. Ultimately, it's up to the federal government to decide whether cruise ships will be allowed, but the strong message from the province is they should not be here this summer.
I think even with the public seeing what happened in cruise ships, the mindset around the cruise industry has certainly shifted. I want to ask you about a conversation that happened yesterday. Premier Horgan and NHL Commissioner Gary Bettman spoke. What did they talk about?
They spoke about the return of hockey, Farah, and Travis mentioned games in front of no fans. Well, the thought here is that Vancouver could play host to what the NHL is describing as a hub city. The league obviously hasn't decided yet if hockey will return to finish this season, but based on that conversation between NHL Commissioner Gary Bettman and Premier John Horgan, it seems like Vancouver is very high on the list as a possible place to be a hub city. The games would be played in front of no fans, but Vancouver and BC has been leading the way in terms of low rates of transmission, and also this province has a strong history of hosting and has the venues needed to host. So the sense is that if there is a place that could be chosen as one of the hub cities, Vancouver is one of them. But Premier Horgan acknowledged there's been no timeline yet from the Commissioner on exactly when a decision will be made if hockey will return, but there is a real prevailing sense for a lot of hockey fans at least want something they can watch on television. So this will be for broadcasting, not for in-arena games. But the other factor too, those borders, them being closed right now, is a concern and something that's being discussed, as well as mandatory 14-day isolation if you come to British Columbia from outside of the country. So all of those challenges have to be tackled. Our Chief Medical Health Officer, Dr. Bonnie Henry, also saying she would need to approve any plan for the NHL to return. She's optimistic it's possible, but still needs to see those details.
Okay, sounds good. By the way, I love the artwork. Is that the legislature behind you?
Thanks, Farah.
On the left, is that your...
It sure is, yeah.
Oh, and then who made that?
So Bailey, my 8-year-old, made these. They've been rotating through. So we've done the icons of British Columbia. Cherry blossoms are so iconic. I know they're not from here, but they are an iconic part of our spring. So the cherry blossoms are up there as well. We've had a Sasquatch, an Ogopogo, sort of institutions of our fine province. So we like to, Bailey loves being able to share her artwork with everyone.
Oh, Bailey is fantastic. She certainly has a future. Thank you. Let's bring in Mike LeCouture now. Now, Mike, one of the things, I know you don't have artwork, kids' artwork behind you, though you do have kids. Maybe they could start making
Parliament
artwork.
Hill behind me?
I do
That's
like
not
Parliament
good
Hill.
enough for you, Farah?
Maybe a nice picture, a nice sketching, by one of your kids. Say, make it a little bit better. I don't know.
Why? I got stuff in my desk. If my daughter's watching this, she's going to be terribly upset at you. I hope you understand that, Farah. But that's fine. Whatever. Why don't we talk about news then?
All right, let's do it. What I want to specifically talk to you about is antibody testing. So we know that in the States, because we were just talking about the border, we know that there has been antibody testing in the States that hasn't worked. This is a very difficult test to get right. But this is really good news because Health Canada has approved a new test that Health Canada obviously thinks will work. How widespread could this be, Mike?
Yeah, and so it's a serological test. So as you said, it's that blood test to see whether or not people have the antibodies. And the hope here is to know whether or not there is a proportion of the population who have either maybe had a mild case of coronavirus or just have the antibodies. And the reason that's important is because think about it this way. If a province is trying to restart its economy and is able to figure out within the workforce who already has the antibodies and who may be likely immune against COVID-19, then they can possibly say, all right, you can go to work, whereas somebody who doesn't have the antibodies, we might want you to continue to work from home. So Health Canada has approved this one. A statement yesterday said further research will also help us fully understand the relationship between positive antibody tests and the protection against reinfection. Now, some have been calling this the gold standard of understanding the spread of the infection. And so the research, research has shown that when you do recover from COVID-19, there is a level of immunity that you have from the virus. It's just unclear how much and how long that lasts. And it's important for that possible second wave that a lot of people are anticipating. And the Prime Minister talked about that today and spoke about this testing and why it's important, highlighted that in his comments right off the top. And so it is a significant step forward. And that is something that I think a lot of Canadians have been waiting for when you consider a lot of the bad news that we've heard. At least there is some good today.
Yeah, clearly the antibody testing and then, of course, hopefully a vaccine, some sort of solution between China and Canada that we've been talking about. But there's a lot of people working on vaccines right now. So we'll see what happens out of that. Let's talk about the in-person meeting at the House of Commons right behind you. What do we expect to come out of that? I know Jagmeet Singh said this morning he wants to bring up sick leave. He wants everyone to have 2 weeks of sick leave so that if you're sick, you don't even consider going back to work because you're already getting paid. What else do you think we're going to hear about?
Yeah, and frankly, there are a lot of workplaces that are already considering that type of thing, where if you start to come down with a case of the sniffles or something that maybe in the past you would, power through and say, I'm okay. There are already workplaces that are saying there are rules in place. Look, no, you have to stay home for 48 hours. Even some say 14 days. One thing that I think that in addition to what Jagmeet Singh will be raising as an issue, I think that you're going to start to see the Conservatives go back on that $1 trillion price tag on the fiscal financial debt of the country for this fiscal year. That has been something that the Conservatives continue to harp on, specifically because they believe that this government is just using this time to spend and spend and spend, so they want to make sure that there are some sort of limits put in there. So I would expect to see a number of Conservative MPs raise that to the Prime Minister in that in-person meeting of the House of Commons. It's a special meeting, as we've told people many a time here, that it's specifically dealing with issues around COVID-19. And I think the Bloc Québécois might bring up funding for long-term care facilities. That has been a concern, especially in Quebec. So I expect that to dominate today.
And testing at long-term care, I know we heard the question that Ontario is saying by Friday they're going to have done all their testing at long-term care facilities. Quebec is far behind that, and Trudeau, of course, asked about that and said it's provincial jurisdiction. Also, no commitment of a fiscal update from the Prime Minister. How do things usually work?
Yeah, I mean, normally we would have already had a budget laid out, right? So in March, we were expecting the full budget from the federal government. That didn't happen, and then they continued to figure out whether or not they can provide any of these fiscal updates. The Prime Minister asked about that at length again today, whether or not there will be one, why there isn't one. And this is something that, opposition parties continue to ask as well, but I think the answer will continue to be, we still don't know when the light at the end of the tunnel will be so that we can present a snapshot of where we will be going. Because as the Prime Minister said, a budget or fiscal update is normally a snapshot of 12 months ahead of time, and they don't even know what's going to happen next month.
There is so much that we don't know. All right, Michael Couture, thank you so much.
Thank you.
Now, here's a quick update for you and recap of what the Prime Minister announced today. Trudeau was asked multiple times about whether or not Canada will extend the closure of the U.S.-Canada border. The PM would not answer. He would not give a date. He only said that he has spoken to Trump, several times over the last few weeks, and talks are continuing. They're constructive. The Prime Minister was also asked about why the government isn't putting together a budget or fiscal update, and you heard Mike say he said things are changing quickly. Thanks so much for joining us. We now return you to your regularly scheduled programming. Have a great day.
Hello everyone. It's a pleasure for me to be with you. Ça me fait plaisir d'être avec vous aujourd'hui.
I'm pleased to be here today. Today we'll begin with Dr. Tam.
I will follow afterwards, and afterwards my colleague Carla Qualtrough will also have some news to announce. Donc, par la suite, Dr. Tam va aller en premier.
So Dr. Tam will begin, after which I have an announcement to make and information to give you. After which my colleague Carla Qualtrough will be providing you with more information and answer your questions. And of course, question period will be hosted here in the room.
Bonjour à toutes et à tous.
Good afternoon, everyone.
I'll start with the latest numbers on COVID-19 in Canada. There are now 71,486 confirmed cases, including 5,209 deaths, and 34,496, or 48% of cases, have now recovered. Labs across Canada have tested over 1,169,000 people for COVID-19 to date, with about 6% of these testing positive overall. We're now testing on average of 26 to 28,000 people daily. These numbers change quickly and are updated regularly on canada.ca/coronavirus. Today, Statistics Canada released information on excess deaths in Canada. Excess deaths is a measure of the additional deaths that have occurred over and above the expected number based on trends for previous years. It is an important way for us to understand the full impact of an extraordinary event like COVID-19 against expected mortality. La surmortalité rappelle également qu'une crise importante.
It is also a reminder that a significant crisis like COVID-19 can have health consequences beyond the illness itself, such as increased illness and death associated with mental health issues, problematic substance use, or delayed health seeking for acute and chronic health conditions.
Crisis like COVID-19 can have health consequences beyond the illness itself, such as an increased illness and death associated with mental health issues, problematic substance use, or delay in health seeking for acute and chronic health conditions. Delays in seeking urgent care for life-threatening illnesses like heart attacks or stroke can result in immediate increases in death rates, while delays in chronic disease management like diabetes care can affect medium and longer-term illness and death rates. Likewise, delayed or missed appointments for prevention visits to maintain routine vaccinations increases the risk of infectious disease outbreaks and associated illness and deaths. So, as we review these numbers that tell us of the broader impacts of COVID-19 on the health of Canadians, I am reminding everyone that it is vital to maintain health visits for yourself and your family. That includes keeping health visits for everything from prevention and vaccines to mental health and chronic disease management, and not delaying getting immediate attention for life-threatening health and mental health concerns. Healthcare providers have implemented a range of precautions to prevent the spread of COVID-19 and ensure patient safety. This includes screening patients before appointments, staggering visit times to maintain social distancing, and in some cases, making virtual appointments available. So speak with your healthcare provider to see what options are available for you and your family to safely have your health needs met. Thank you. Merci.
Merci, Dr. Tam.
Thank you, Dr. Tam.
Ça me fait plaisir aujourd'hui de lancer un message.
I'm pleased to send out a message to all entrepreneurs who are working night and day for the survival of their businesses, as well as to ensure that they can bring their employees back into their organizations. I know that we're going through a period of major stress and anxiety. My message for you today is that the government is here for you. Today, I'm pleased to announce the launch of the Regional Recovery Fund, about $1 billion fund that will be managed by the regional economic development agencies. Those agencies are in the Atlantic, it's Atlantic, in Quebec, it's DEC. In Ontario, there are two, FedNor in Northern Ontario and FedDev for the rest of the province. And in the West, it's Western Diversification Agency. And for the North, it's Canada. We have already created a safety net for people and major economic measures for our businesses. Now, if you have fallen between the cracks, or if, as entrepreneurs, you do not have access to the $40,000 credit or to the emergency response benefit or other help measures, come and see us. Talk to your economic development agency, because we want to help you. If you are working in the tourism sector and you have no access to funding, if you are a business in Rivière-du-Loup or Promenade Fleury in Montreal, we are here to help you. Not only for the tourism sector, of course. There are many other examples I could give you, such as the high-tech sector or the manufacturing sector. The idea is that our agencies will be more flexible, will be able to adapt measures on the ground and be able to respond to your needs. We're doing this to relaunch our economy, to ensure that the economic recovery is fair to all.
Hard-working entrepreneurs that are working day and night right now for the survival of their businesses, and also to ensure that their employees are able to have access to a good job during and after the pandemic. So the idea right now is to provide solutions, because we know that you're going through a period of stress and anxiety. My message to all entrepreneurs and to all Canadians is the government is there for you, and we've got your back. Today, we're announcing the launch of the Regional Relief and Recovery Program. This fund is a $1 billion fund that is there to help businesses. If you are a business and you fell through the cracks of the system, if you're not able to have access to the wage subsidy, if you're not able to have access to the $40,000 loan, the CESB account, well, come and see your regional development agency and we'll be there to help. In Atlantic Canada, it is ACOA. In Quebec, it is DEC. In Ontario, in the north part of Ontario, it is FedNor. In the rest of Ontario, it's FedDev. In the west, it's Western Economic Development, WD. And also in the north, in the three territories, it's CanNor. So, for example, if you're in the tourism sector and you're not able to have access to funding, come and see us. If you're in the tech sector and you're a new startup, please feel free to contact FedDev and other agencies. Or if you're in the manufacturing sector, obviously, we're there to help. The idea is to make sure that we can offer enough flexibility and be adapted to regional realities. The agencies are close to the ground, have their eyes and ears close to the ground, and are there to help. So the goal of this program is to make sure that we restart appropriately the economy and that we can have an equitable relaunch of our economy. Merci. Thank you. Now to my colleague.
Bonjour. Thank you.
Carla.
Can you hear me?
Yes, very well. Go ahead.
Excellent. Okay, well, good afternoon, everyone. I'm very pleased to be with you here today. Comme nous le savons tous très bien,
as we all know very well, the month of May is when students across the country normally start summer jobs. Unfortunately, these are not normal times. Many student jobs are no longer available due to COVID-19, which presents a unique set of challenges for young Canadians.
Should be supported through these difficult times. That's why on April 22nd, the Prime Minister announced the Canada Emergency Student Benefit, a direct support to students who are struggling to find work during the summer months and who are worried about paying their bills and tuition in the fall. I'm happy to announce today that starting this Friday, May 15th, students will be able to apply for the new benefit through the Canada Revenue Agency. To help manage the volume of applications, applicants will be asked to apply over 4 days, like we did with the CERB, depending on their month of birth, and can expect their payment in 3 to 5 business days from when they are deemed eligible if they're using direct deposit. If you're a student and have never filed a tax return, you'll need to call the CRA to activate your social insurance number so that you can apply for the CESB. You'll then be able to set up a My Account and be ready to apply for the benefit this Friday. The website will be going live today with clear details on who is eligible and what Canadians need to know in order to apply when the application process begins. Le PCUE pourra être versé de mai à août.
The CESB will be available from May to August to students and recent graduates who are not receiving the Canada Emergency Response Benefit and who are seeking work but unable to find it because of COVID-19.
To Canadian students studying abroad, as well as high school graduates who will be starting a post-secondary program in the coming months. Through this benefit, eligible students will receive $1,250 per month from May to August 2020, or $2,000 per month for students with disabilities or students with dependents. This money will not have to be paid back. Just like the CERB, students can make up to $1,000 over the 4-week period for which they are applying. Cette prestation pour les étudiants pourra aider environ
The CESB will be available to approximately 1 million part-time and full-time students who can't find work.
Our government remains fully committed to supporting all Canadians, including the Canadians who need it most. Through important measures like the CESB, we'll continue to do what it takes. Thank you. Merci beaucoup.
Merci, Carla. Donc, maintenant, on va y aller.
Thank you, Carla. So we'll move on to questions. Thank you, Minister. This begins the questions. We'll start with the questions on the telephone. Operator.
First question. Notre première question nous vient de Hélène Bigetti avec Le Devoir. Please go ahead. À vous la parole.
Yes, hi.
Question from Le Devoir.
My question is for Minister Qualtrough. It's regarding the benefits for students. 2 weeks ago, when this was discussed and voted in the House of Commons, opposition had problems with the benefit, and they wanted some changes, and that's why the bill that was adopted was pretty vague, and there was a promise that in the regulations there would be some additional details. You promised to the NDP that you would put it to $2,000 for students who have children, which you did. But you also promised to the Conservative Party that there would be a link between students and available jobs. And to the Bloc Québécois, you promised that the amounts of revenues that they could keep before losing the benefit could be changed, and could change from the $1,000 that was first decided. So I don't see in what you're announcing today any indication that you fulfill your promise and that you listen to the opposition parties. Can you be more specific about that?
Well, thank you for the questions. It's super important to clarify. So maybe I'll go quickly through each of them. With respect to the concerns that we have direct links to available work, it's actually right in the bill itself that we have to direct students to the job bank, and in Quebec to the Quebec's equivalent. We have to tell students where they can find work, what jobs are available. With respect to the limit of income a student can earn right now by regulation, it's at the same as the CERB, but as I've said, as the situation evolves, we will continue to talk both on the CERB and the student benefit as to how we can make it easier for people to transition back into their work. And I apologize, I forget the third one. What was the third one?
Oh, the NDP, but you did made the request.
Okay. Yeah, we worked really hard with the and we did thank you. I think the point is we worked really collaboratively on this, and by giving regulatory flexibility in this act, we can continue to respond quickly without having to go back to change the law itself.
So are you saying about the $1,000 of revenues that a student could keep, which is the same as for someone getting the CERB, are you saying that could change in the near future? Is that what I should take it away from what you're saying?
I wouldn't say the near future. I guess what I'm saying is, as we look as a government, as we head into recovery and as provinces open up their economies, there is regulatory flexibility in both cases for the CERB and the student benefit to monitor the situation and change accordingly as it evolves. But no, it would be very premature for me to say that that's coming anytime soon.
Merci. Prochaine question, opérateur.
Thank you. Merci. Our next question, notre prochaine question, is from Jim Bronsko with the Canadian Press. Please go ahead. À vous la parole. Mr. Bronsko, please unmute your line.
Yes, thank you. We're interested in knowing about testing, and now that officials have an approved antibody test, what precisely do they plan to do with it in terms of public testing, since the science on COVID-19 immunology isn't quite settled yet?
This is Teresa Tam. I'll answer this question. So yes, Health Canada authorized the sale of the first COVID-19 serologic test. So that's a test for your antibodies or your antibodies to the virus itself. So as you correctly pointed out, we don't know enough about the immunology of COVID-19. And these tests, in general, will test for antibodies that appear days or weeks after the infection. So they're good as a look at what the proportion of the population has been infected, for instance. So the approach that we're taking in Canada is to use these tests, first of all, in the context of population studies. So the immunity task force that was formed just a short while ago has been really active in trying to accelerate and prioritize these tests so that we can use them to determine across the population an estimation of how many Canadians are infected in different places or different age groups or in different risk populations, for instance. So that will be the first key use. And at the same time, together with research organizations and funders such as the Canadian Institute for Health Research, we have to study the immunology, the immune response to the virus at the same time. And then we can interpret these tests as to what they mean for an individual. So it is a little premature to be able to use these tests and interpret them on that basis. From a population level, these tests will be used in conjunction with the PCR tests to look at how they can be incorporated then into a wider testing strategy. But right now, under the collaboration of the Immunity Task Force, our priority is focusing on the population survey. Also to understand there are designs of these studies over time as well, to look across at least 2 years time span to see how the population changes in terms of their antibody response. That will give us even more information about how effective are these antibodies at protecting someone maybe against a second encounter of the virus, and how long does immunity last for. So I think it's a great news that the first test has been authorized. I also feel that we are benefiting from some of the information coming from other countries where they have had some experience with serologic testing. Some of the tests didn't perform very well. So we are sort of learning from that experience as well.
En suivi?
Okay. Yes, thank you. I'm not sure who is best placed to answer this one, but once the economy starts to reopen, more people without sick leave benefits are going to be returning to work, as you know. What will the government's role be in making sure they can stay home when sick without being penalized for doing that?
I'm happy to weigh in on this one. So we're very aware that a key component to our return to work safely and positioning businesses and workers to feel confident they can go back to work will be making it easier to choose to stay home if you're feeling sick or if you're not well or if you're worried about having been exposed to COVID. So we're working actively with the provinces. I know this is the discussion that's happening between the premiers and the Prime Minister to see how we can help. As you know, right now under the CERB, if you're sick or if you are quarantined, of course, you can access the CERB, and we're going to look to see how we can continue to support Canadians moving forward and in what way we can best do that.
Merci. Dernière question au téléphone, opérateur.
Thank you. Merci.
Last question on the phone.
Notre prochaine question nous vient de Lina Dib avec la presse canadienne. Please go ahead. À vous la parole.
Question from La Presse Canadienne. Question. My question is for Minister Qualtrough. If you could answer in French, that would be greatly appreciated. Could you please tell us, in practical terms, how you're going to match students with the available jobs? What is the federal government going to do precisely to fulfill this promise made to the Conservatives? Answer. Thank you. That's a very important question. We certainly don't want to do anything to dissuade people from going back to work. And for students, there will be opportunities, we believe, to work across the country this summer. So one of the measures we've created was an additional 1,600 jobs across Canada. When we created the application for the CESB, we also told students about the job bank, which is
Excuse-moi, je ne sais pas comment l'expliquer en français, mais c'est...
I'm sorry, I'm not sure how to say it in French, but it's an opportunity that shows all the available jobs to the students.
To the job bank and help them become connected with employers. Mel?
Lina, essentiellement, ce qu'on va faire, c'est qu'on a créé un portail.
Essentially, what we're going to do is that we've created a portal showing the various job offerings. And in the context of the CESB, those who wish to apply first will have to go through the job portal and therefore see what jobs are available in their own regions. And that's what Carla has just explained to you. Answer, thank you. Question, so if I've correctly understood, there won't be any obligation on the students' parts. They will be able to benefit from the information, but will not be forced to apply for a job and have it refused, have their application rejected before they can apply for the CESB. And could you also explain, because the students finish their school year at different times, I imagine this is only for students who have finished university, because CEGEP students have not yet finished school.
Carla, please unmute yourself. We can't hear you.
Excuse-moi.
Answer, I'm sorry. It depends when you finish your studies, indeed. So for students who are still in high school, it will be available for only 2 months. But for post-secondary students, it will be available for 4 months. We're not going to force students to accept a certain job, any specific job, but they do have to affirm and attest with their application, in their application, application that they are actively seeking employment, that they're not refusing any jobs, and that they're actively seeking employment.
Please, Mike from Global.
Thank you. Dr. Tam, can we go back to the serologic testing? How confident are you that these tests can provide officials with the information needed to help people affected by the COVID-19 stuff?
Well, I think serology tests, that's tests for the antibodies, will play an important role. We just need to be able to use them wisely, if you like, or smartly right now, which, as I've talked about, involve using them for population basis, but then at the same time study the immunology so you can interpret these tests for individual basis as well. I have to say that, Health Canada is trying to authorize the sale of these tests as carefully as they can to determine that the tests that they do authorize have met certain levels of criteria. But according to Health Canada's guidance on the serologic tests, a condition is applied to the authorization so that in order to monitor the ability of these tests to perform once they're being used in the healthcare system. We've seen how some tests perform in a lab system inside the conditions of the laboratory, and then they're used in the real-world system. How do they perform? How specific are they? Can they actually detect the specific COVID-19 antibodies or not, and also their ability to, their sensitivity or the ability to detect the antibodies when they're present. So I think all of that remains to be seen, which just means that we need to evaluate and monitor these tests as carefully as we can as they are implemented, whether they be part of these studies, which is the best way to monitor their performance, or otherwise. But so that's where we're at the moment, but it's great that we now have the first test.
Thank you. And what are the next steps to rolling this out on a countrywide basis, or what's the plan?
Yes, so as I said, the Immunity Task Force has been formed. So they've been working really, really hard to try and accelerate the process. And so they're trying to do this in a matter of the next couple of weeks. They were targeting about, I would say, by mid-May to scale up some of the fundamental work on the field work on immunity. So I think right now, the foundations are being built now that you have the first test. We're hoping to see some of rapid implementation of the actual population surveys, both general and those focusing on sort of specific communities, geographies, occupational group. And so I think they're just working as fast as they can, and hopefully this will be, quite rapid in terms of its rollout. And we're participating in provinces and existing research networks that have already been formed to look at immunity as well. And so it's a bit of a big partnership, and it, of course, involves many researchers across the country. But what we have to do, I'll just reiterate that we want the top quality immunity tests identified so that you can actually do this properly.
Thank you. We'll now go to Molly from CTV.
Hi, Molly Thomas, CTV National News. My questions today are for Dr. Tam. Dr. Tam, how important is it to test asymptomatic people like Alberta is now starting to do? I mean, are you advising this right across the country, and do we have the capacity for this to roll out nationwide?
I think that's the capacity question is an important one as well, but and also one of equity. I mean, obviously, we want to make sure areas that don't have access or good access to laboratory testing all have access to that. I think we are updating our laboratory guidance as well. So with provinces and territories, all the chief medical officers, all the public health laboratories and experts, as I've said, lowering the threshold to test anyone with even mild symptoms is really key to just broaden and widen that net really, really well. And also for high-risk situations. For example, in certain settings, like not just long-term care, but maybe in homeless settings, in our correctional facilities, in some of our Indigenous populations, the moment you see someone who's sick, very rapidly testing them, and then testing even the asymptomatic contacts within some of those settings would be important. For example, in some settings, people can't tell the symptoms very well, or they may not have symptoms. So those are the priority asymptomatic people to be tested. And contacts, really, of cases, or in the context of certain outbreak situations, you would want to look at the testing of asymptomatic people. Certain work sites, for example, that experience outbreaks, for example, the meat packing plants, you would want a very low threshold to test even the asymptomatic people in that setting. As to whether you should widen it for the general population, the way we're looking at it is what kind of sampling frame would you want to look at? Is it part of some of your efforts in surveillance, if you like? So right now, a number of provinces are discussing, well, if they have the capacity to just look at population-based and community-based testing, they're looking at those protocols. The key is that we would like to learn from across the country and the provinces who might be implementing some of these pilots, if you like, that we learn from them and see exactly what happens with the test results. And so I think that's the most important thing. But for sure, widening the net by lowering the threshold for testing people with mild symptoms will be the first layer, and then looking at what else can be done.
My second question has to do with masks, Dr. Tam. Obviously, there's more people out and about with the loosening of restrictions around the country. Quebec's premier was encouraging everyone in that province yesterday to put a mask when they walk out the door. What are the new rules? Are there new rules here? I guess is my question. I mean, should I be wearing a mask right now? Should you be wearing a mask right now? Or is there any kind of uniformity around masks in Canada?
It's a topic of great interest, I would say, all across the country. And again, with the Chief Medical Officer of Health, we're looking at this in the context of reopening or the economy. And so I think our collective thinking is still that it depends on the disease activity in your population. So according to the epidemiology and whether there's actual community transmission in your jurisdiction, it is recommended that you wear, or in the general public anyways, wearing of non-medical mask or facial covering in situations where you cannot maintain physical distancing of less than 2 meters. Some of those examples are public transport, or when you are doing certain types of retail shopping or grocery shopping, for example. But it does depend, because some jurisdictions say, well, we actually haven't had any community transmission. So in our situation, it doesn't apply as much as if you were in the middle of a much more complex, crowded city where the situation for maintaining the 2 meters is a problem. We also discussed the complexity of implementation. C'est plus facile à dire qu'à faire, comme toujours.
It's easier to say, easier said than done.
But when it comes to implementation, there's a lot of complexities, not the least of which is that we did not want to discriminate or adversely affect vulnerable populations who may or may not be able to do some of the social distancing or physical distancing measures, and make sure they actually have, if you're recommending masks, you would have to make sure that people have access and be able to implement that. So I think the concern was that we must not inadvertently increase that divide and that the support that's being provided. And so there's a lot of careful thinking that needs to be done. But, I've just talked about the general overarching recommendation. And I think the other thing is that we keep having to sort of reiterate that there are tried and true measures that everyone must remember. This is going to be a difficult period for people to remember. Number one, staying home if you're sick. Number two, wash your hands frequently. Number three, cover your cough, of which adding a layer of protection, such as a non-medical mask, is an added layer of protection that people can consider under those circumstances. And so I think, it's different layers of protection, but I think must not forget all the other layers is the fundamental piece that we would like to communicate.
Thank you, Dr. Tam. We'll now go to last question in the room before we do a final round on the phone. Julie?
Julie Van Dusen, CBC. I have two questions for Dr. Tam. The first one I'll have to read. It was provided by a colleague. Ontario has updated their case definition of COVID-19 to include multi-system inflammatory vasculitis in children, which appears similar to Kawasaki syndrome. How significant is this? Is this the first province or territory to do so in Canada?
So again, with all the chief medical officers, we've been looking at a broadened list of symptoms or clinical conditions for considering for COVID-19. I think that pediatricians and others have already been alerted to this potential condition, multisystem vasculitis syndrome, or variants of Kawasaki disease. So it's really an alert to clinicians to think about what might be the underlying causes, because it's not specific to COVID-19. Kawasaki-like syndromes can be as a secondary effect, or your body's reaction or inflammatory and immunologic reaction to viruses and other infections. So it's not specific, but it is important to catch people who are presenting with these syndromes and further determine whether COVID-19 could be a cause. So I think it is consistent with the broader thinking across the country.
One follow-up.
And my second question is, I've heard you numerous times expressing concerns about the calamity that's going on in long-term care homes. And so as the head of Public Health Agency, I'm sure you've thought about this a lot. So I guess I'm wondering, do you think it would be best to put them under the Canada Health Act? Would it be best to have a dedicated transfer with strings attached? Well, I'm asking you as a health professional. With strings attached, i.e., if you have too many people to a room, you don't get money. If you have no inspections, you don't get money, that kind of thing. If not these two ideas, which are floating around, what's the solution?
Yes, as I've said, that the key very tragic characteristic of our COVID-19 crisis is the impact on long-term care homes. And so, obviously providing the necessary guidance and ways to prevent the introduction of COVID-19, as well as the ways to rapidly address any outbreak, is of paramount importance at dealing with the outbreak right now. And I think going into the future, we must not let these lessons sort of be forgotten. So I think improving all of those standards and conditions for our seniors is very important. It's not just long-term care homes, seniors' residences and other places where we support our seniors are very important. And also the workers who work in those settings, including as much as possible reducing transfers between these settings will reduce the transmission of infectious disease. And so I think, really be able to review all of the lessons learned from this situation is important as we move ahead. And so I'm sure ministers will be discussing these in the context of their plans going forward.
So you have no view about whether they should go under the Canada Health Act? You have no view?
I think that's best left to our policymakers, for sure.
We'll go for one final round on the phone, please. Moderator.
Thank you. Merci. Our next question, notre prochaine question, is from Carly Weeks with the Globe and Mail. Please go ahead. À vous la parole.
Hi, this is for Dr. Tam. You had mentioned off the top about the report on excess deaths. So what we saw today from Stats Can, it doesn't really show any real spike in deaths in Canada, at least up until the period that they looked at. It also doesn't provide a cause of death or other important markers. What is your read or interpretation on what this report tells us about deaths in Canada so far this year?
Yes, so this is just for the first quarter of 2020. And so, of course, Canada's COVID-19 epidemic began to accelerate from about mid-March, but the bulk of the illnesses and deaths, of course, hadn't occurred by the end of March. So this is a preliminary look at excess mortality. And also, it is only from 9 different provinces and territories. So we're still gathering data from the rest. So it is incomplete and preliminary. But it forms a really good foundation to look at the impact of this pandemic or crisis in another way. The actual benefit of looking at excess deaths is, the fundamental question we're asking is, well, what would occur if this event had not happened? So what would have occurred in the number of deaths if this event had not happened? And then what actually happened, and could we attribute it to the COVID-19 itself? The benefit of looking at this indicator is that it does not require it's not really skewed by any differences in the way deaths are reported or how death certificates are filled in, etc. It gives you an overarching sense of the excess deaths. And it also allows us to look at the full impact of this pandemic, whether direct or indirect. So we can talk about the direct impact of the virus, but there may be other illnesses or conditions that have increased as a result of this pandemic. So it gives you a more fulsome picture of the full impact of the pandemic itself. And so I think I see it as a preliminary sort of baseline upon which we can sort of build on. And StatsCan have said that they will be updating these tables on a monthly basis. So we can look at what happens. And I'm particularly interested in the month of April when that becomes available, because that's when a lot of the illnesses would have occurred. So maybe I'll stop there in case there was any further questions.
Well, I just had one really quick follow-up. So I've spoken to some epidemiologists today who say that, while it's a great baseline, sure, the lack of, cause of death or, place of death, such as hospital or home, it doesn't, it makes the report really limited. And that if this data doesn't become available soon, and most of the time this kind of data is only available a year or two after the fact, it's really not going to help us at all when we respond to COVID-19. So, they're concerned about this. They say it needs to be addressed. How do you respond to that?
Well, I think this is one set of data which comes from vital statistics offices of provinces and territories. We have to, as you said, and I think the concern from a number of epidemiologists or policymakers that we do have to have better data. So again, working with StatsCan, trying to improve the data on the actual COVID-19 cases. I see excess deaths as adding to that dimension, and that from this perspective, I think it's not one single indicator that's going to help us. What I have to say is it's true that mortality data usually comes after a lot of confirmations and the gathering of information and not as timely basis. But I see that vital statistics officers are trying very hard. Giving us the first quarter is actually something that is quite an extraordinary effort, however limited it is. I'm sort of encouraged by the efforts being made by provinces that have come to at least try and put these statistics on the table. Do we still have a ways to go? Yes.
Thank you. Next question.
Thank you. Merci. Our next question, notre prochaine question, nous vient de Philippe Vincent Foisy avec Radio-Canada. Please go ahead. À vous la parole.
Question from Radio-Canada. Hello. My first question is for Dr. Tam. I'm trying to follow you because a few weeks ago, you said that there was no point testing asymptomatic people because if they had no symptoms, they probably weren't sick. And now you're saying that it would be a good idea to test them, especially if people are working in close quarters to one another. And then with masks, it wasn't a recommendation because you said it didn't provide much benefit. And now you're saying that it is a good idea to wear masks. Can you explain to us how you've changed your position in just a few short weeks? Answer. The most important thing is to test all people with symptoms
severity, the symptom.
No matter what the severity of their symptoms. So even for people who just have small symptoms, as if they had a cold, or a headache, for example, it's a very good idea now to test all people with symptoms. That is the first strategy. But in certain contexts, for example, if there's an outbreak in an environment that is high risk, such as long-term health care homes, or in homeless shelters, for example, it's very important. If there's even a single case of COVID-19, it's important to test all the people in that environment, even those without symptoms. Other than that, there are some pilot studies, for example, in other populations, for testing asymptomatic people. And there are protocols for those pilot studies. Follow-up question. And what about wearing masks and serologic tests? Why is it changed? And Minister Joly, when it comes to tourists, the tourism sector, they've asked for direct assistance, and why haven't they received that yet? Answer. Once again, Dr. Tam, for serology tests, we have a single test that is available that has been approved by Health Canada so far. And it's very important to obtain further data about these tests, as to the quality of these tests, for example. So, the use of serology tests at this time is for studies in the population. There is a task force that's been created to study immunity and to determine what the immunity levels are in our population. And that's our main priority in Canada. At the same time, we need to better understand the immunology, how antibodies increase in a person's body. And after that, we may be able to better interpret and use these tests and other diagnostic tests in the general population. It's a bit too early right now to deploy serology tests when it comes to the tourism sector, for example.
So I think I did respond before with the serologic test, which is, obviously right now, the performance of these tests needs to be carefully monitored. We're primarily using the serologic test right now in the context of population health, population studies, these cross-sectional population studies to determine who has got infected, but also to increase our research on the immunology or the immunologic response in the human body, which would then help us interpret individual diagnostics. So really right now it is too early to interpret what those test results might mean on the so-called immunologic passport, I think. For that, you need to know, what kind of test does this person have and how long ago. Well, what does it actually mean? We don't have enough of those answers to interpret these kind of questions. So really, we need more information.
Madame Joly, rapidement.
Oui, si je peux me permettre, en fait, bonne nouvelle pour
Minister
le
Joly,
secteur
quickly.
touristique. Il y a de
Yes.
l'aide.
Answer. There is help for the tourism sector through the wage subsidy, through the $40,000 credit program. But if some businesses do not have access to any of those measures, now they will be able to turn towards their own regional economic development agencies. So I invite businesses in the tourism sector who are currently worried about the coming season to consult us and come and speak with us, and we will find solutions together. Thank you. Next question on the phone.
Our last question, notre dernière question, nous vient de Jamie Pashagamskam with APPN News. Please go ahead. À vous la parole.
Yes, thank you. My question is the Canada's prison system. There's another lawsuit against CSC that came out this week. When is Canada going to deal with the problem of inmates not feeling protected in Canada's prisons?
Well, do you want to give Dr. Tam? Do you want to go ahead?
So I think given the environment of our correctional facilities, it is extremely important to be able to respond, to prevent actually COVID-19 entry, but also to prevent its spread as soon as we know that there has been even a single case. So at least from the Public Health Agency's perspective, at the federal level, we've been working with Correctional Services Canada to make sure that they have the necessary infection prevention control protocols to ensure that they have the sort of technical support that is needed should they actually have a case. And we have to work with the provinces and territories and the local public health unit to make sure that testing occurs very rapidly, should there be a case for these different settings, and to ensure that there's a proper supply of personal protective equipment, should there be any kind of signs of outbreak, or depending on what's happening in that community. So I think instituting these infection prevention control measures are very important. It is very difficult in certain settings to do physical distancing, for example. So each of the institutions must be able to sort of look at their plans for how they're going to protect both the inmates as well as the staff. And for the staff, it's not just about because they do go back to the families and they do mix in the community, is general recommendations on preventing infection in everyone it's of paramount importance. So again, the core public health measures of essentially making sure there's proper hygienic measures, people being able to wash their hands or maintain those. Again, it's probably something that people should be extremely mindful of in the context. Environmental cleaning, not to have any crowded conditions, changing schedules to protect people. And so I think all of that is or has been worked out in the different institutions. But I know that at least from the Correctional Services Canada, they're taking this extremely seriously.
Okay, thank you. And concerning Indigenous inmates who make up the bulk of prisoners in federal prisons, has anything specifically targeted towards the Indigenous population in these prisons been looked at? For example, targeted release programs?
I'm uncertain about release programs, but what is important, I think, is the recognition at the public health level that anyone who is being released from different correctional facilities must have a plan, including plans for quarantine or isolation as appropriate. Because I think Indigenous peoples are overly represented. If they go back to a community that isn't prepared, then they need to be able to prepare with their own infection prevention control measures. So supporting people, as they be released from institutions, knowing what their plan is for infection prevention control. If there are local requirements for isolation or quarantine for 14 days, for example, if that's in play, they need to be supported in order to do that, to protect themselves, but also their community. So those kind of plans are really important.
Merci. C'est ce qui conclut la conférence de presse aujourd'hui.
This brings today's press conference to an end.
Bye, Carla. Merci.